Hi, everyone. My name is Bimal Maharjan, and I have been a constipation patient for many years. What I realized was constipation is a symptom, not a disease in itself, and it's a very multi-variable problem. And there isn't one pill that's going to solve my problem. And also, there are many things that I need to do to resolve this problem. Then I decided to be a scientist of my own body and solve this problem for once and all. And I went through this journey. I went through the learning journey, self-experimenting journey, and spent thousands of hours understanding what is constipation, what causes it, what are different kinds of constipation, and so on. What that helped me was to truly understand what's causing it and then take remedial action to live constipation free and prevent and also recover from it. So I am creating this video so that you don't have to spend that thousands of hours and you can shorten your path to recovery. Hence, in this episode, we will be talking about understanding constipation, what causes it, what different kinds of constipation, so that this creates a foundation for you to understand your own problem and then seek to solve your own problems. And in the next episode, we are going to talk about how you can be a scientist of your own body. So in the previous episode, I walked you through in depth about my journey of constipation, what it triggered me to write a book, what triggered me to start a company, and what are things that I did to get free of constipation. So let's begin. And let me give you a brief overview of what we are going to talk about today. First of all, we are going to talk about the first question when most people have in mind. Even I had that question. Why me? And it's strange that when we learn if we are not alone, it's quite reduces some kind of stress. It's quite a strength, and we are going to talk about that. Number two, then we are going to talk about what is constipation. And number three is we are going to what different causes of constipation. And we are going to talk about different nuances of constipation. And then going to talk about the stool chart and also get into some formal definition of a constipation. So let's start. And before I begin, I also want to add a disclaimer that this is not a prescription or diagnosis or any form of clinical inform, clinical substitution. All of these information are for your knowledge, your foundation knowledge only. And if you want to change anything, if you have any clinical question, please contact your healthcare provider. They may be able to guide you for clinical decisions to be made. And however, having said that, when you go through this video or this information that I am presenting to you, you will be able to understand and ask right kind of questions and help you make the clinical conversation more productive with your doctor. Again, this is not a medical advice. This is a information for you, education for you to best navigate your disease and how to prevent that. Let's begin by answering question, why me? Obviously, I had that question in my mind, but when I did a little bit of research, I did my own personal research in which I asked around people around me, and that the discovery I made was very, very astounding. And also, the second thing I did was I went and researched for data whether what percentage of people around the world or in the United States have that kind of problem. And let me begin with my anecdote experience. When I started talking about people, my friends around it, many people, like 2 out of 3 people had this kind of either some gastrointestinal disorder, and constipation was very common. And that made me realize, why aren't people talking about this? I become a bit shameless to talk about this because I have that nature about sharing my problem, and because I believe that when I share my problem, maybe someone has answers to it. In that hope, I share. But many people do not share because they feel kind of embarrassed to talk about. And obviously, it's a poop, and people do not want to talk about bowel movement. Maybe some people find it disgusting to talk about it. Maybe because of that, is most people struggle silently without talking about it, and that's why as as people do not talk about it, one may feel very isolated and lonely and think that, okay, it's just happening to me. And I can attest to the fact that it's not just me or you, it's very, very prevalent. And that's from my anecdotal, personal experiences asking people around. And when I looked for the data, what I learned was, and that surprised me, like up to 15% or more than 15% of the US population have constipation. And I reckon there may be more people because, as is from my personal experience, people do not talk about it because they are embarrassed about it. I think it could be underreported because people are embarrassed to talk about it. And therefore, I also went on to the third data set, which also said that up to 40% of the people may have constipation. While this is so prevalent, people aren't talking about it because maybe there is some kind of taboo associated with it. People are embarrassed to talk about it. And that's one thing which I also want to break this. When I felt I was not alone on this, it was for some twisted reason I felt quite satisfying, and it just stressed, it gave me a little bit of less stress. Hey, there are other people as well. It's like when you are walking in a jungle, you're by alone, and there's some people walking behind you. It kind of strange feeling of safety. I mean, similar kind of feeling that I had when I learned. It's not just me. There are other friends that I have and other people around in the US and around the world who had that problem. So therefore, it's important to feel not alone. It's important to feel that there are other people around you who are in the same boat, and also they are seeking for solution. That means that it's not just the personal problem, it's also structural problem as well. And what are those structural problems that causing constipation on me? It will be very interested to understand that. And that made me more curious to go and understand what's causing it, just on causing the constipation on me and other people. And that's where we can talk about what is constipation and understand deeper about definitions of it. Let's move on to the next topic. When we hear about constipation, the most common sentence that we hear is, you are constipated if you have less than 3 bowel movements per week. That's more common. But in reality, it's much more nuanced than that. And when I went through the learning process, I stumbled upon this criteria called Rome 4 criteria, and which is actually quite useful, and it gives some nuances of it and helped me understand what was the type of constipation that I had. Even I can define my problem as constipation. For example, I had multiple bowel movements per day, but my bowel movements were, I felt incomplete. I had hard lumps, I had to strain, and it had gone for more than multiple years. So even though I had multiple bowel movements per day, it was very partial, incomplete bowel movement, hard lumpy lumps I had to strain. That can be categorized as constipation. And let's go constipation. So in the most common sentence that we hear, which is less than 3 bowel movement per day, per week, your constipation, if according to that particular sentence, I'm not constipated at all. However, when I went through the Rome 4 criteria, then I said, okay, I'm constipated as well. So let's go through more uh, understand this Rome 4 criteria. And in this one, I want to get it right. So I want to read through the Rome 4 criteria. So, and Rome 4 criteria has for adult and also pediatric criteria. Let me get on to the Rome 4 criteria first. So adult Rome 4 criteria establish a functional constipation diagnosis when a patient has experienced two or more of the following over the preceding 6 months. Number one, fewer than three spontaneous bowel movements per week. Number two, training for more than 25% of defecation attempts. Number three, lumpy or hard stools for at least 25% of defecation attempts. Four, sensation of anorectal obstruction or blockage for at least 25% of defecation attempts. Five, sensation of incomplete defecation for at least 25% of defecation attempts. Six, manual maneuvering required to defecate for at least 25% of defecation attempts. So when I went through this, understand, voila, all right, I'm constipated as well. What I can do about it? So those are the nuances of it. And let's also understand a little bit of for pediatric Rome 4 criteria as well. So here are the following. Let me read through this so that I get it right. I get it right. So pediatric Rome 4 criteria are met. At least two of the following are present for at least 1 month in infants and children up to 4 years. For children older than 4 years of age, symptoms should last for at least 2 months. Number one, fewer than three spontaneous bowel movements per week. Number two, at least one episode of fecal incontinence per week after the child has acquired complete bowel control. Two, number three, history of extensive fecal retention or withholding behavior by child. Four, hard and painful stools. Five, large fecal mass or on digital rectal examination. And six, large diameter of stools causing rectal outlet obstruction or that obstruct the toilet. So those are the pediatric Rome 4 criteria. If there is one or two of these criteria are met, your child may be constipated. For me, at least, I had, although I didn't check for fewer than three spontaneous bowel movements, I had multiple bowel movements. So following were full checked out for me. Training for more than 20% of difficult attempts, I had to strain every day. Lumpier hard stool were at least 25. Almost all stools were hard stools. And senses of endorectal obstruction or blockage were at least, I didn't feel that, but I definitely felt the senses of incomplete defecation for almost all my bowel movements. And I didn't require manual maneuvering, but three of these criteria were met for, and that went on for multiple years. So therefore, I could have a general sense that, okay, I was constipation, and what were causing it? What do I was constipated. And this is actually a very good guideline to understand what is, what is constipation, whether you are constipated or not, and then accordingly, based on this, you can talk to your clinician about it. For me, at least, when I started to prevent this, I used this as a guideline and started recording my bowel movements and did multiple things to, check whether, okay, whether my straining is reducing or not, whether my type of stool is becoming soft or not. So I use this as a guideline to take actions and the recording to build a feedback loop for it. So which I'm going to talk about in uh, the next episode about being a scientist of our body, but this episode is about creating a foundation. And I hope this foundational definition helps you to understand what's causing it. And what is the definition of constipation? And after understanding this definition, what I did was, again, what's causing it? And there may be multiple reasons. And even before that, I was very surprised to learn, okay, there are different causes of it. And before the causes, I also needed to understand, which this Rome 4 criteria helped me is, there may be different types of constipation altogether. And that can be categorized in the following ways. So number one, there are three broad categories. Number one is slow transit constipation. Number two is normal transit constipation. Number three is uh, pelvic dysfunctions. Now let's just understand what are different types of constipation. And before I get into that, what I stumbled upon, and this is exactly I must give credit to someone in Reddit who has started this constipation advice subreddit and has given a very good uh, list of questions to ask so that it helps you to understand what category of constipation that one may have. So number one is, and I want to give shout out to that because again, through the learning process, you've stumbled upon so many great people who have synthesized the information, and I must uh, give credit to someone. And here are the questions that that helped me understand it. Number one, do I have the urge to go or not? That's number one. If I have the urge to go, whether I can go or not. That's number two. In addition to this, do I have other symptoms such as nausea, vomiting, acid reflux, difficulty swallowing, and or early satiety? That what means is getting full early on. Or did I have this issue from my childhood? So did this start after certain medications or not? Or did I have the history of sexual abuse or any form of trauma? So this is a good list of questions to ask one by one and record it. But when I went to this checklist, number one, do I have the urge to go? Yes, I have the urge to go multiple times, but it required me to strain or I get an incomplete bowel movement. So what that means is my I had the normal transit constipation, but it requires some straining of it. What that also mean was I also had some kind of motility problem, and I realized why it was causing it. And third, what I did not have was I did not have the neurological problems. So I could broadly get the sense of what's causing it, which I'm going to talk about more. But this list of questions is very useful to understand, okay, to get the direction and to the sense that what's causing it. So in this sense, when one goes through these questions, it's very helpful to understand. At least that was helpful for me. And then when I went and learned about, okay, what are the actual categories of it, which even clinicians, you know, categorize. So there are three ones. Number one is normal transit constipation. Number two is slow transit constipation. Number three is pelvic floor dysfunction. So normal transit constipation. So although the transit of the stool through the colon is at a normal rate, it is difficult for patients to evacuate their bowels. That was my case. And second was slow transit constipation. So it is characterized by infrequent bowel movements, diminished urgency, or straining to defecate. In addition to these, patients have impaired colonic motor activity, which is related to gut motility. And number three is pelvic function dysfunction, pelvic floor dysfunction. So it is distinguished by impaired musculature of pelvic floor. Patients often report a feeling of incomplete evacuation, prolonged or excessive training, or the use of perineal pressure during defecation. So when I heard these categories with the list of questions I mentioned earlier, it helped me understand. Okay, rule out at least. Okay, I rule out. I don't have slow transit constipation. I do defecate. I don't have diminished bowel movement urgency, so I can rule that out. Third thing is I do feel some form of incomplete evacuation, but I don't have the prolonged excessiveness or I don't have to manually maneuver it out. So I may have some pelvic floor dysfunction, but it's not that, acute for me. So it's mostly normal transit. And when I understood these three categories, so it helped me understand and more deeper. So for layman, where I understand, okay, there is some normal issues that I have, which probably be caused by some lifestyle issues. Number two is about when I talk about slow transit constipation, it's about gut motility. Then maybe because of some neurological and physiological problems. And third is pelvic function dysfunction is more of anatomical reasons, which is reasons. So I was able to understand, okay, what may be causing it, and then causing the constipation problem for me. So now for you, I listed the questions, I listed different categories of it. Then it will be helpful for you to understand what's causing it. And another way of categorizing this thing is primary or secondary. So normal transit, slow transit, pelvic floor dysfunction are the generally the primary categories of it. But the secondary categories could also be such as the if you have other kind of diseases and that's causing constipation. For example, if you start a medication, that started causing constipation. If you have trauma, that's causing constipation. So that can be a secondary category. So again, understanding what's causing it, what are different types of constipation that applies for you. At least for me, when I understood that, okay, for me it's mostly normal transit constipation, which I also tested with at home. So beetroot test. So when I drank the beetroot, it it didn't take 24 hours to come out from as a bowel movement. It took me around 12 hours of it. So I had normal transit, but I had some problems with my, some problems in a difficulty of evaluation. So I was able to get general sense what I need to do next. And now let's get to the what are different causes of it. The different causes could be number one, huge cause is the lifestyle. So that's one. Number two is obviously the neurological disorders. And number three is the, the anatomical pelvic function dysfunctions or any anatomical. For example, there may be a tumor, there may be some kind of obstructions, there may be some strictures in the strictures, and obviously some other forms such as uh, the hemorrhoids and fissures would also uh, cause constipation. In my case, I had fissure and I had hemorrhoids. It may have impacted my constipation, but it's a it's just kind of circular. Constipation causes hemorrhoids and fissure, and also hemorrhoid fissure causes circular. So I need to break that circular cycle. So I went and did that as well. So let's understand more about different causes of it. So number one cause, at least for me, is uh, the diet and the diet that lacked fiber uh, slows down. The diet that includes a lot of processed food can cause constipation. Number two is dehydration. So hydration is super important because it lubricates and it makes the stool soft. For me, I was dehydrated. Number three was sedentary lifestyle. What that means is I wasn't getting enough exercise. I was sitting more longer because I have a job in the software industry, so desk job. So I'm sitting about 12, 14 hours a day without going out. and a very stressful as life as well, because I was going to the film financials, and also the professional stresses that I was going through. So all of those contribute into the constipation problem for me. And one more thing which I want to add was I did not have the alternative between diarrhea and constipation. For that, if you have that, then it could be IBS, which is irritable bowel syndrome. Sometimes, when you have constipation, then you have diarrhea, then if switch between the two, then it can be IBS. So again, when you understand the general, categories of it, such as normal transit, slow transit, pelvic dysfunctions. Okay, what are different in between that? Okay, what is the kind of constipation that I have? For example, or I have multiple bowel movements, but I have to strain and the lumpy stools. So I do have the urgency to go it. So if you have a diminished urgency, it could be a slow transit one, right? And then how it could be because of the low gut motility, and low gut motility can be of a neurological or a physiological, and obviously like when you have the pelvic function dysfunctions, you may feel incomplete bowel movement. You have to prolong evacuate, straining, or you have to use manual maneuver. So those are different categories of it. And depending on what is causing you, what category you are, you can have the next step. So that's what I'm talking about, being a scientist of your own body. And these general foundation information will be helpful for you to understand that. At least it helped me a ton. So I also want to read out few, you know, different causes, uh, which can causes as well. For example, let me list from the dietary causes. So dietary causes include inadequate fiber intake, inadequate water intake, overuse of coffee, tea, or alcohol, and also reduced level of exercise. I talked about sedentary. Most of these things check out for me. Another second is anatomic causes. So structural causes of constipation include anal stenosis or atresia, anal fissure, anteriorly displaced anus, imperforate anus, thrombosed hemorrhoids, intestinal stricture, obstructing tumors, and anal stricture. And I reckon that the for most people, I think, should be the lifestyle causes, not the animal causes, because life we are living a lot of sedentary life. That's the reason why I say like constipation problem can be reversible without huge interventions. And again, it depends on the type of constipation you have. For me, it was mostly lifestyle, so therefore I was able to change everything about my lifestyle, which is causing it, and reverse and prevent my constipation problem. That's the reason why I say like constipation problem can be reversible without huge interventions. And again, it depends on the type of constipation you have. For me, it was mostly lifestyle, so therefore I was able to change everything about my lifestyle, which is causing it, and reverse and prevent my constipation problem. The third one is abnormal musculature. So this or disorders include Lune-Bailey syndrome, gastritis, Down syndrome, and muscular dystrophy. And another cause are neurological causes. Disorders with issues in neurological structure of intestines include Hirschsprung disease. And especially if you have been having constipation in childhood, this could be one of the reasons why the Hirschsprung disease, pseudo-obstruction, intestinal neural dysplasia, spinal cord defects, and spina bifida, or other neurological disorders that could lead to constipation include stroke, Parkinson's disease, multiple sclerosis, Chagas disease, and familiar dysautonomia. So this could be categorized as secondary category because is causing, again, I said earlier as well, constipation is a symptom of some other problem. It's not the cause of it. But again, so for example, constipation is a symptom of sedentary lifestyle. So it's because of something else. So when you understand the root cause, then root cause of it, then we can have action plans to mitigate that. Whether it's through prevention, mostly for lifestyle, it can be through prevention, and if it's through other, like different causes, intervention can be done. And surprisingly, one more category is drugs. So medications contributing to constipation include anticholinergics, narcotics, antidepressants, lead, iron, bismuth, calcium channel blockers, calcium channel blockers, non-steroidal anti-inflammatory drugs, psychotropic drugs, and vitamin D intoxication. And this is right surprising. A lot of it takes iron supplements. So iron supplement can lead to constipation as well if it is overdose. A lot of other uh, uh, people take calcium channel blockers. That can cause constipation as well. So we pop up ibuprofen or Advil. So that can cause constipation as well. So again, it's about recording it and understanding when it started, so it coincides with the medical drugs intake. Then we can relate that to, okay, drug is a trigger point, starting point for constipation. And another different causes are metabolic and endocrine causes. So metabolic or endocrinologic disorders that cause constipation include hypokalemic, hypercalcemia, hypothyroidism, diabetes mellitus, and diabetes insipidus. And some other miscellaneous causes are celiac disease, cow milk protein allergy, cystic fibrosis, inflammatory bowel disease, and scleroderma. The last one, I don't even know what that is. Maybe you may be able to find out. So there are different causes of it. So when we understand what's causing it, what different categories of it, then it helps us to understand, okay, what's the action plan? At least uh, if it's preventable, because as I said earlier, it's about the lifestyle causes, diet, hydration, stress, then those are preventable. And that's why I say like 99% of the chronic constipation problem or solution or any gastrointestinal or any chronic disease is self-care and 1% is clinical care. And with this foundational information is going to at least it helped me understand what was causing it. And when I had more information, I understood many things are in my control. I became excited about solving it because these are in my control. Less variable in our control. So again, help me understand if some things are out of control, requires intervention, I can get asked help. Now, when these things are in my control, I can take action and get better. So in summary, understand that if you have, if you have urge to go but cannot go, it may be a, you know, gut motility, or it may pelvic function dysfunction. But if you have a urge to go, but you have incomplete bowel movements, so that's different category. If you have other symptoms, that different category. So based on these questions and heuristics, you can understand what different categories are, different causes are, and based on when you understand the root cause of a problem, then obviously you can understand uh, what action step you can take. And that's what we are going to talk about in the next episode. So before I get in next episode, there's one more topic that I want to talk about is which is going to be an important tool. That tool is understanding of stool, visual understanding of a stool, and that is Bristol Stool Chart. Now let's talk about very important and very simple tool to understand our digestive health. And that tool is the Bristol Stool Scale. And there are 7 different categories of stool according to Bristol Stool Scale. Number 1 is type 1, which is separate hard lumps like nuts. It's like a golf ball size, and obviously the diameter of golf is ball is bigger than the diameter of our rectum, so it's very difficult to pass and it's very hard to pass. That's type 1. Type 2 is sausage-shaped but lumpy, which is, let's think about this golf ball, but elongated one. The diameter is still bigger than our rectum and it's very hard, it's still very difficult to pass. Type 3 is a little more less in diameter than type 2 and it's more sausage shaped, but it has cracks on the surface. And type 4 is the ideal one, which is like a sausage or snake shaped, which is more smooth and soft. And type 5 is soft blobs with clear-cut edges, pass easily. And type 6 is fluffy pieces with ragged edges or mushy stool. And type 7 is watery, no solid pieces at all. Again, the ideal stool is brown in color. It have push, little bit of smell, snake shaped, and when there is no straining and complete bowel movement with less than 2 minutes or 3 minutes. That's the ideal one. So that's what I used. So when I became scientist on body, my goal was to get that ideal shape. And I started off with, the type 1, then gradually moved type 2, and went to type 3, and when I had type 4 and complete bowel movement as soon as I wake up, that was one of the happiest days of my life. Can't imagine even having a complete bowel movement gives you so much happiness. So that's what I had. So we are going to use this tool scale to become the investigator of our body or the science of our own body. And our goal is to get type 4. And there are many things that in our control. Even if we are normal transit or slow transit or dysfunction, dysfunction, there are things that we can do to get our bowel movement. And our Bristol Stool scale we will use as a compass whether we are heading to the right direction or not, and it can be gamified so that we know what we can do, variables we can control, and then we can eliminate different variables, whether that's impacting or not, one by one. And then it's like solving a piece of puzzle. We piece together all the variables and we'll remove it and add. Then it will help us to record all things of what causing it, when it's causing it. And that will obviously, if it will help us to prevent, uh, it will help us to recover, and if we are getting a treatment or we are it will help us to diagnosis as well, because when you're eliminating, it will help us to get more tests and ask for relevant tests. For example, you know that, okay, you're exercising well, you're eating well, but still you have constipation problem, and that means with some pelvic dysfunction, then you can go and get a different test and still doing something is oscillating between diarrhea and constipation, that is could be IBS. So again, these are things when we record it, the patterns will start emerging it, and obviously, Bristol Stool Chart is a very accessible and visual toolkit in our disposal that we are going to use it. So this concludes our second episode about understanding constipation, which causes, root causes, and understanding the Bristol Stool chart. This is a foundational knowledge information. I had to. The reason why I made this is when I started journey, the information are very diverse. I had to go through multiple places to read this information and experiment this and real experiment this. And I hope this synthesis of this information will be helpful for you to obviously take action on your own, things that you can control. And if you can't control things, then you can go and help. And when you're knowledgeable enough to ask the right question, because presenting this information to your doctor is super important, and we have to, as patients, be proactive about it to present this information to our doctor, because sometimes they have such limited time, they do not go through these questions, and diagnosis may take longer. Remember, our goal is to shorten the path of recovery, shorten the path to get better. And the more we take proactive action and we take uh, charge of our health, the faster we can get to recovery. And our goal is to do that. And see you next time. In the next episode, we will be talking about how to be scientists of our body, how we can prevent and recover, uh, and we'll use the Bristol Stool Form Scale as the compass to guide us. See you next time. Until then, please share, subscribe to our channel because the more if you subscribe, it'll help us to grow and reach to more people who need help in taking charge of their health and living constipation-free life, preventing constipation, and also get towards not only that but also help more people with GI issues take charge of their own health. Thank you so much. See you next time.